Hello everyone, my name is Dr. Ashad Narayanan, working as a general practitioner in NMC Medical Center Al Majaz, Sharjah. Today I'm going to talk about something that's really important for all the people in UAE, that is dehydration, heat exhaustion and heat stroke as well. As you see the summer really hitting and the sun is soaring nearly 40 degrees Celsius. As the day passes, it's going to be more heater. So which of the people are really under risk? That is the people who are working in the outdoors and who are elderly individuals and even a healthy adult as well. But try not to worry. This condition is 100% preventable when you follow the following steps, what I'm going to say right now. Dehydration can happen when your body loses excess fluids than you take inside. How did it occur? It occurs when you've been having excessive sweat, lack of water and vomiting, loose stools and certain medical condition as well and a medication as well. What are the symptoms? You will feel the symptoms I'm sure you have a dehydrated. If you have a dry lips, dry mouth, you will have little headache, you might be having a muscle cramp and fatigue as well. Even the mild dehydration can feel like you're really ill. If you ignore that, it can lead to a serious medical conditions. Heat exhaustion happens when your body exposed to overheat due to prolonged exposure to the high temperature, especially you have been dehydrated. What happens when you have been heat exhausted? The conditions are you may have a vomiting, you may have a really excessive sweat, you may have a plain and clammy skin, and along with you have a really rapid heart rate and a weak pulse as well. What you need to do the time or you yourself or your colleague has a similar complaint what I said now, you need to make him to the colder places and which is a shaded area. Try to make him drink good amount of water, maybe an ORS really helps it, and try to make him to relax and try to cover his body with a wet cloth or sprinkle some water on his body and try avoiding exposure to sun again so you can prevent from the heat exhaustion. Heat stroke. As I said, heat exhaustion. What happens when in case of heat exhaustion, if you ignored it, it can progress to a serious condition called heat stroke. What is heat stroke? Heat stroke is a serious life-threatening condition in which your body regulation of your temperature fails and increases in your internal organ temperature goes to more than 40 degrees Celsius. What happens that time? You will be really hot, but despite you don't have any sweating at all. You may have vomiting, you may have a really bad headache, you may have a light headache. Sometimes you feel disoriented and loss of consciousness as well. And you may have really rapid heart rate and a strong pulses as well. What you need to do that time, we need to call the ambulance or speak to a doctor. If an ambulance, you can call 998 and you can speak to a doctor. In the meanwhile, what you need to do is you need to yourself or your colleague has to keep it in shaded places and make him drink good amount of water and sprinkle some water on his body, let the body get relaxed, and please monitor his breathing till the ambulance arrives. By that, we can prevent the heat stroke. That's a good question. Who are the people at risk? All in UAE, the people who are rich most are vulnerable people are outdoor activities people, the people who works in constructive, delivery person as well. Next comes the people who are really chronic illness, that is diabetic, and people who are fasting in the time of the summer, and people who are a tourist and non-resident to the UAE, especially children and the infants. As I explained to you, that is what is heat exhaustion and heat stroke as well. Let me explain you how do we prevent this from this heat exhaustion. That is, always remember, hydration is the key. Drinking 8 glasses of water can really help you prevent from this hydration and prevent from dehydration as well. Next come, how do we drink it? We can drink as lemon salted water and coconut water as well. And always remember, you should not allow your body for thirst. And try to avoid some excess tea and excess tea or coffee and soft drinks as well as much as possible. Next come to your clothing. How are you supposed to wear in the time of the summer? Try to wear a cotton clothes. We should wear air entry passage should be there when you've been roaming around in the summer. Next comes, always try to wear a hat, an umbrella and sunglasses when you've been stepping out from your home or going for the work. And try always a sunscreen which is of SPF 50 plus as much as possible so you can prevent from sunburn as well. Next comes, as I said, hydration and clothing. How do you yourself prevent from getting outdoors? if you're an outdoor person, you've been working as in a job, try to avoid from 12 in the noon and 4 in the PM, try to avoid working at that time. Okay. Next comes, try to be in an air conditioned room all the time in the time of the summer, and try to have a cold shower in the late evening when you finish from your work, and try to help each other, look after your elders and neighboring as well who has similar complaints, which I said previously, on heat exhaustion and the heat stroke. As I was explaining, how do we prevent it? Next comes, might be running in your mind when to see a doctor. You need to see a doctor if at any of the symptoms that you've been listing now. You feel unconsciously you feel disoriented, and you feel persistent vomiting, you feel really hot and you're not sitting at all. You need to call the ambulance 998 and you need to speak to a doctor immediately, because it can lead to a serious condition called heat stroke. Let the take-home message be very simple this summer. Water is life, shade is a safety, cool down before your body breaks down. Always please take care yourself, your community, your family, and stay hydrated, and please stay aware as well. And please pass this message to other people who need of these messages, and stay hydrated like how we drink water.